COVID numbers in the state, we are now at 13%. 9,300 cases reported in the last week. 300 are now in the hospital. A new poll is out on just how concerned people are about catching COVID. And it's surprising, plus how vulnerable are immunocompromised people right now. And long COVID and mental health. News 8's Lisa Carberg is here with all of this. Lisa.
And that study was done by Gallup, and this graph has results tracking Americans' level of worry about getting COVID. And you can clearly see the decline even from that January-February plateau this year when cases and hospitalizations were both running very high in the U.S. and here in Connecticut. That Gallup study of Americans' lowering concerns over catching COVID has surprised some, but Yale psychologist and epidemiologist Dr. Marnie White points out it was taken in April when things were settling down,
when case rates and hospitalizations were much lower. This is a constantly changing situation, and I think that a poll taken today, when we know that cases and hospitalizations are rising yet again, would likely yield different results.
White says now more people are masking up in public again. She points out any lagging concern about COVID is very bad for immunocompromised people. White says they are very vulnerable with fewer masks around and lack of measures for them like remote learning.
Everyday life extremely difficult for them. People who are immunocompromised describe feeling betrayed and are experiencing very high rates of depression, stress, panic, and loneliness.
The growing number of people now becoming infected with COVID in Connecticut has her attention.
I'm very concerned about hospitalizations and actually also concerned about rising infections because we do know that so many people are experiencing long COVID.
As a psychologist, White is witnessing mental health and neurological issues with those long COVID sufferers, including children.
Now, sadly, in children, the psychological symptoms of long COVID might even be missed or misinterpreted as behavior problems or misattributed to situational issues instead of being recognized as a very tragic consequence of COVID infection.
And sadly, she says experts are following reports of suicide among people suffering from long COVID because of the debilitating multi-system difficulties that keeps them from working and leading a normal life. More studies are being done. Lisa Carberg, News 8.